If you're watching this, chances are you or someone you love may benefit from a smarter way to screen for prostate cancer. Prostate cancer is curable with early detection. So why does it remain the second leading cause of cancer death in men? The key to early detection is prostate cancer screening. The common screening tool, prostate-specific antigen, or PSA tests, are important for some men, but annual screenings may not be right for everyone, and false PSA test positives can result in unnecessary and potentially dangerous biopsies. Ideally, we would screen based on risk, but how do you know your individual risk? Relying on family history alone may not be enough. Fortunately, now there's a new tool, a genetic test called PROMPT. With a simple cheek swab, PROMPT provides you with a personalized genetic score to assess your risk for prostate cancer. PROMPT compares your genetic profile to tens of thousands of other men, and along with family history, can help you and your physician determine the best screening approach. To begin, open the PROMPT kit and remove the single-use cheek swab by its handle, being careful to avoid touching anything with the sponge tip. Next, gently place the swab in the rear of your mouth and rub it back and forth along your lower gums. Be careful to avoid touching your teeth. Rub back and forth 10 times, then repeat the process on the opposite cheek. When you're done, remove the cheek swab. Be careful to hold the tube upright to avoid spilling the blue liquid inside. Unscrew the cap from the tube without touching the sponge. Then, insert the sponge end into the tube and screw the cap tightly. Finally, vigorously shake the tube 15 times. That's it. You're done. Your sample is sent to our labs for processing, where your personal genetic score is determined. Together with your physician, an informed decision can now be made about screening. Understanding your risk level helps make a tough healthcare decision a little easier. PROMPT. Knowledge is power.